According to our text, telehealth is the use of telecommunication and information technology to enable healthcare services remotely. Other terms for telehealth include telemedicine, e-health, or mHealth. Telehealth is used to provide immediate services in psychiatric emergencies, when travel is difficult, in underserved communities, and more recently, during situations of contagious disease spread. During this presentation, we will learn more about telehealth and the role informatics plays in it. Today, we see an ever-increasing use of smartphones and other devices in our daily lives. Telehealth services use these devices to connect healthcare professionals with patients. Informatics is defined by Merriam-Webster Dictionary as the science of information. Telehealth relies heavily on the ability to be utilized effectively, and therefore, the way providers and patients access and use the technology is extremely important. This is where informatics comes into play. With telehealth, it must be studied and made as easily utilized and as safe as possible in order to be a legitimate and desired option for patients and providers. The use of telehealth services increased by nearly 70% between 2014 and 2016. With the COVID-19 pandemic, telehealth services have increased even more. There are not ethical codes in place specific to behavioral telehealth services, but in light of the shift to this type of services, concerns have been raised around telehealth services that are currently being addressed. One of the largest concerns with telehealth services and the privacy of the client are third-party platforms and their involvement. These third-party platforms include the browsers, online applications, hardware and software required, as well as the insurance companies, some of whom require sessions to be recorded. While these recordings and the information documented during these sessions is to be encrypted, transmitted, stored, and eventually disposed of, all of which are risk for breaches. Patients acknowledge and sign consents in most cases that state that these risks are present, but the significantly increased risk of confidentiality breaches is a lurking concern that many providers of telehealth services are navigating currently. Additional concerns are that patients don't always have access to private spaces in which to meet for telehealth. Are patients able to fully discuss their concerns with the provider, and are providers able to fully assess the situation? The full picture of this concern waits to be seen. In 1999, the World Medical Association made a statement around the ethics of telehealth, stating that telemedicine should not be viewed as equal to face-to-face care. Another concern with telehealth is how to monitor patient and provider locations and how to navigate this when licensure and billing come into play. The U.S. Department of Veteran Affairs overrode state restrictions on telehealth provider licensing by permitting veterans to access care from VA providers anywhere in the country. The VA statement surrounding this was that by enabling veterans to access care from wherever they were better able to provide urgent mental services and to serve veterans who otherwise had to travel hours to VA facilities. Many laws around telehealth focus on reimbursement for services. Most states require insurance to cover telehealth services. Some cover at full cost, others at a percentage of the reimbursement rate for in-person services. Different states in the U.S. have various laws around telehealth services, and they have changed or been adjusted significantly over the duration of the COVID-19 pandemic. Only 38 states have laws around informed consent when providing services via telehealth. 11 state Medicaid programs require sessions to be stored and forwarded in order to be reimbursed by payers. While all 50 states require insurance to provide some reimbursement, only 21 states require reimbursement for remote monitoring services. Current exemptions are being allowed due to COVID-19. Namely, practitioners are being allowed to practice with patients in states outside their own. The past year has put a lot of focus on telehealth and the protections needed for all parties. Laws and policies will undoubtedly continue to evolve as the pandemic continues and after, as telehealth services continue. Telehealth includes a variety of remote healthcare services. These services can be provided by nurses, pharmacists, social workers, patient education sessions, medication checks, mental health, or health issue checks. Telemedicine uses telecommunication to deliver test results, diagnoses, and other therapies, as well as referrals to providers. Telecare includes technology used to allow patients to remain at home, safe and independent, and may include monitors, fitness applications, sensors, medication reminders and dispensers, or early warning detection technologies. Mobile health is yet another and newer concept that is supported primarily by cell phones. These services include wireless patient monitoring, personal digital assistants, and sometimes tablets. Typically, telehealth services are provided via video communication applications or electric monitoring services. These services promote independence among elder populations or those with mobility issues or who struggle to travel to their appointments. During times of pandemic, telehealth allows for quarantine while still receiving medical care. Telehealth connects persons in rural and underserved areas with the appropriate specialist or providers. As mentioned previously, telehealth services are dependent on technology such as the telecommunication devices used to administer the services, internet connections, and software and applications to host the services. Aside from those tools and technologies, there are so many more involved with the various telehealth services. In underserved or highly populated areas, there are often struggles with visiting the doctor in person. In India, where the medical facilities are predominantly in the city, where only 27% of the entire population reside, and in many other areas of the world, doctors and patients rely on remote monitoring. This is facilitated via devices throughout the country and sometimes in the patient's own home. Sometimes that might be by a visiting nurse. These measure the patient's stats and then send them electronically to the patient's provider. Other tools utilized in a remote manner might include blood sugar monitors, heart monitors, thermometers, blood alcohol monitors, and scales. All of these provide valuable information to the provider and allow for accurate assessment and treatment remotely. In this video, you will hear testimony from an elderly patient who benefits from telehealth services.
In 2008, I was diagnosed with Parkinson's disease, so I thought I'd sell up and come to Brisbane to be near my family. Well, I was seeing a neurologist in Brisbane, but it took a whole day for me, leaving here in the bus, going up to the Mater, and at 8 o'clock I had to get the bus, and then at 12 o'clock was my interview for half an hour. I had to wait till 4 o'clock to get the bus home, which meant a whole day away for half an hour. So I definitely think that telehealth is suitable for the elderly, especially for bedridden patients who can't get access or difficulty getting people to see a specialist.
Older people.
Professor Len Gray goes on to explain that telehealth is a much more comfortable way for many elderly patients to receive care and also allows several providers to meet with the patient at once and therefore is much more convenient for all involved. Psychiatric emergencies are not limited to areas where there are providers available around the clock. These emergencies are never expected or planned, and often these patients seek help at the emergency room. This video from South Carolina ETV explains how their state utilizes telehealth services to bridge the gaps that once haunted this state.
Providing mental health services to people who live in very rural areas. The idea is to do it to increase access, to maintain quality, and to make sure that night or day, 24/7, including weekends and holidays, there is a doctor available. So we decided to go statewide with telepsychiatry, which is the mental health aspect of telemedicine or telehealth.
Are you okay talking with me? Yes.
Whenever we have patients that are acutely psychotic, depressed, suicidal, homicidal, anything that we deem that the patient needs to have a referral or have a consultation with a psychiatrist, we have that service available to be able to get that consult locally.
Telehealth is a valuable addition to our medical and mental health treatments in the U.S. and elsewhere. Not all situations are appropriate for telehealth, however, many are. Telehealth brings services to those who may not have access or who would face hardships in order to access the assistance they need. If the COVID-19 pandemic has taught us anything, it's to be flexible while still prioritizing our physical and mental health. There are policies and reimbursement issues to address, and as we are navigating this pandemic, many of these are being addressed at accelerated speeds. Telehealth is very likely a staple in healthcare as we progress and as technology grows. Thanks to informatics, telehealth is the way of the future.